I am Phillip Wessinger with Steadman Hawkins Clinic of the Carolinas with the Greenville Hospital System. I want to talk to you today about carpal tunnel syndrome. Carpal tunnel syndrome is one of the compression neuropathies, which more simply put is that the nerve in your hand that goes to the thumb, index, and long finger is under pressure under the ligament as it crosses your wrist. This causes you to have pain at night and numbness at night when you're sleeping. It also can cause you to have pain and numbness as you use your hands for repetitive activity, or if you're having to hold your hand in a particular position for a period of time. Generally, this is confirmed as a diagnosis from our physical exam, as well as a study called a nerve conduction study and a EMG. Those studies tell us how quickly the nerve is conducting electricity to your fingers. A nerve is very much like a wire in that it carries an electrical current. If that current is slowed down, then you begin to get the symptoms that you experience with carpal tunnel syndrome. By measuring how slow the nerve is and in conducting that electricity, we get some idea as to what sort of treatment you may need. If the nerve is very slow, that's considered severe carpal tunnel syndrome, and it also implies that there's some damage that the nerve has received. In that case, surgery is really the first answer and the answer that we go to very quickly. If it is very mild and the nerve is close to normal in its ability to conduct the electricity, then we generally use splints at night and sometimes a steroid injection, and frequently we can clear the problem up without ever having to go to surgery. Nerves that are in between, that are in what we call a moderate range, is generally a decision we can make as to how conservative or aggressive you would like to be about treating your carpal tunnel syndrome. This can be based on what your daily activity is, what kind of work that you do, how severely this is inhibiting your ability to sleep and do the things that you need to do, can all be factors in whether we need to go to surgery more quickly or go about doing splints and injections in a more conservative manner. There are also some conditions like diabetes and thyroid problems that can also contribute to carpal tunnel, as well as pregnancy, which is a very common cause of carpal tunnel, which of course will resolve on its own once the pregnancy is over. If you go to surgery, surgery is a small incision in the base of your palm that's approximately an inch. During this surgery, we identify the nerve and release the ligament that's causing the pressure. You generally have 3 to 4 stitches over the palm. Wear a Band-Aid for up to a week or two till we remove the stitches. You're encouraged to move your fingers. The basic restriction is that you do no heavy lifting and that you do not soak the hand in dirty dishwater or dirty bath water during the period of time while the stitches are present. Nerve recovery sometimes is very quick. It can occur even as soon as in the recovery room and in the OR. It can also take some time, particularly those people who have severe carpal tunnel syndrome can take months to resolve their symptoms if they all return. Sometimes the nerve has received some damage that does not completely heal.